Hello, what's going on? So let's start off with right off the bat. We're gonna be given an intramuscular um, injection, and so our we're currently in the med room. We have the information of Mr. Nelson Prince, date of birth 7/01/1960, um, medical record 1999, and it seems like the first injection, as I said, it's going to be in the deltoid. It's what does he have? He has morphine sulfate, 4 milligrams for 1 milliliter, for 1 ml, and so we're gonna do throughout this whole thing. We will do the 3 checks. We're gonna do the first check when we are in the medication room. We're gonna do our 2 other checks whenever we are when we are about to give the patient the medication. So at the bedside, we would do the other 2 checks, and then whenever we do this med checks, we are always checking for the 6 right, the right patient, the right med, the right route, the right time, the right patient, right med, right time, right dose, right route, and right documentation. There we go. And yeah, we're doing that all along the way, the 3 checks. And so, yeah. So, as we're looking at the medicines, we're looking at the 2 medicines, we're comparing the MAR with the doctor's order, the medical order, and we're doing that as well whenever we do the 3 checks. And we're looking at Mr. Nelson Prince, and we can tell that he has same medication for mgs per 1 ml. And also very important, when we do this, we go and then we check the expiration date, and it seems like the expiration date of the medication is 12/25/2025. So the medication's good. Let's move on and check the medication, and then this is when we go in, we go from here to over there, we enter, do some hand hygiene, check for privacy, introduce ourselves. Hi there, Mr. Prince Nelson. My name is Juan. I'll be your RN today. We're going to be giving you this medication, and then can I get your name and date of birth, please? He tells him his name, date of birth, check it, agrees, it corresponds with it, and then we start up with patient information, or patient teaching as well. And then so we could tell him some side effects that could possibly occur with morphine sulfate, which could be confusion, sedation, dizziness, dysphoria, aphoria, floating, feeling, hallucinations, headaches, and the biggest one out of all of these is depression. So yeah, after we do our patient teaching, then we go on and so by now, actually, we would have already done this process that I'm about to do right now, which is getting the medicine ready. We would usually do that at the med room. So it's for doing that, and then later on after that, I'll move on up to this point, if that makes sense. So going back to the med room, which we should have done earlier. I'm looking at the medications, the whole thing, and it says 4 milligrams for 1 milliliter. So we're gonna we can do 1 milliliter of air, and then we grab 1. There we go. Yeah, so we do this part, and then after that, of course, we would go over here, and then so we would put this back, and it's very important not to use the needle, because it could actually it could actually like rupture this part, the little plastic foamy thing, and then that could cause it could cause some side effects to the patient that we just don't want to do, so we avoid doing that. And then so I would actually do this, and then put it here, and then I would label my my syringe. Then we would move on, and then once we were at the patient's bedside table, which I was earlier, we go there and have everything ready, right? So we're like, okay, so here comes the fun part. We go, we are looking at his deltoid, so it's gonna be the triangle thing. We're gonna have an imaginary triangle right now, and then we have the bone right here, and then we're gonna do 1, 2, and then so it would go right here, and then I almost forgot. So this is actually skin prep, but I would whenever I drew medicine from here, I would actually clean the top of the medicine for 10 seconds, wait 10 seconds, and then, hold the medicine, draw the medicine from it. And then also, I would also clean the patient's part. In this case, his deltoid right here, his muscle, part of his section. And then I would clean the area, clean it very well. Once it's clean and dry for 10 seconds, then I would move on, and then I would stretch the skin, and then for this medication, we would have to go 90 degrees, so boom, and it's very important to aspirate, see if we hit the vessels. We didn't, and then slowly, and then at this point I would actually like fully lock this and then throw it away in the shopping container. But for now, I'm doing this because I might use it in the future. So yeah, we dispose this, boom, gone. And then I would later come back and then tell him that I would constantly be checking on him just because some side effects, if side effects occurred, And so, yeah, and then I would document, Then we would move on, and we would go into our second point, which is identify two intramuscular muscles. Yeah, so for this, the two other muscles that are intramuscular, I just remember something. Going back to the first point, I totally forgot to mention that this needle is the deltoid. So the syringe size would be 1 milliliters to 3 milliliters. So it's 1 to 3. The needle length would be 5/8 to 1 inch, and the needle gauge would be 23 to 25. So yeah, forgot that. So going back to the second one, we have we're just identifying and explaining how we would do the injection. So we have our vastus lateralis. We have a big old muscle over here. Let's say this is the muscle. So we would do this, grab our arm, and grab our two hands, and then we would put the medication right in the middle, and that would be same thing. It would be a 90-degree angle, and it would be, the needle length would be actually 1 inch to 1.5. The needle gauge would be 19 to 23, and this one and the next one, which is going to be your ventrogluteal injection, those are going to have, the syringe size is going to be the same. It's going to be 3 mLs to 5 mLs. So yeah, that concludes that part. The next muscle that we could identify for intramuscular would be your ventrogluteal. So that's your glute, one of your glutes, whatever you prefer one, left and right. It's always good to change it up. We would put this part of the hand on top of your femur. You would put it right there, find it, and then we would put our hand like this, and then our injection let's say it's this one. So this would be our 3 to 5 ml, 1 inch to 1.5 inches of length, and the needle gauge would be 19 to 23. So we would grab this, and then we would just put it right there, and then boom, 90-degree angle as well. So the next one is we're demonstrating a subcutaneous insulin. So the insulin, we're gonna demonstrate the insulin in Mr. Who are we doing the insulin in? Clarence. Is that correct? Clarence. Yeah. So for the insulin, same thing. We prepare it. You know, we would be at the med room, do our our 3 checks, the whole thing. Compare MR to the whole process that I mentioned earlier, and once we do this, we check the expiration, which is the same as the other one, 12/25/2025. And then we can see that he's going to be drawn 20 units, and his CBG, his glucose was blood glucose was 189. So yeah, he's going to get 20 units for it. So for drawing, we better grab our little guy over here, clean it off, 10 seconds, wait 10 seconds. We would put 20 units of air. Boom. And we would draw 20 units. We put safety on. Very important. Don't want to do any harm to anybody, including ourselves. So yeah, we would put this in its own little thing and label it insulin patient. Go to the patient and walk in, same thing, our same procedure, hand hygiene, come in, introduce myself, ask him for his name and date of birth. He tells us, we match, it matches MR, the whole thing. We do our 3 checks, 6 right, same thing. And after all that stuff, we tell him, we already looked up our medicine, and then so we start telling some side effects or some possible side effects of the medicine, that he could have a hypoglycemia or hyperglycemia, what could happen, like how would he feel and stuff like that and everything. And so after we do that stuff, we go ahead and so our insulin is going to be, this time we're going to do it subcutaneously, and so we could do it in the, let's say we're gonna do it in the upper arm right here. It could also be done in the abdomen, but this time we're gonna do it over here. So we would do it over there. We would clean, and then the angle for this and the needle length would be, well, it would be its own little insulin injection, so it already comes with it. And yeah, so the angle, it would be 45 to 95. Okay, yeah, so we would, since that makes sense, since our arm, it's at a different angle, it's at a 45 to 95 angle, but let's just say that we're at that angle right there, right? And then so we'll just be right here, and then boom, we clean the area and everything, and then we will slowly release. Oh, also something very important that I have not mentioned that I forgot to say earlier is that every time after you do an injection, other than every time you do an injection, you want to make sure you hold it there for 10 seconds. 15 seconds. 10 to 15 seconds. How about that? Because I know it might be one or the other. And so yeah, we would so you have to hold it for 10 to 15 seconds, and make sure we keep it there, and then pull it. Yeah. Okay. And then for insulin as well, we will have to aspirate, just so we don't hit that vessel, and then, you know, if it's bleeding, then we have to make sure we discard, you know, we get rid of that, you know, the dose, and then have another one until we aspirate and it has no blood, because that's not good to give an injection whenever there's blood when you're aspirating. Okay, move on. We would document, you know, I would tell him I would check on him later, check his blood glucose, and, you know, that good old routine. Next thing, we would do our heparin. Heparin is going to be in Mr. Clarence as well. So for heparin, we're going to use, it's going to be that, it's going to be the abdomen. It's going to be a subcutaneous as well. Those are, heparin is only taken in the abdomen. And for heparin, we don't aspirate, because it could cause coagulation and bleeding, and we have to make sure we warn the patient if bleeding occurs, or like to make sure he doesn't like shave with razors, because it could cause bleeding more than usual. So yeah, that's something for patient information, for patient teaching that we have to do. So the needle is gonna be, the syringe is gonna be 1 to 3, same as 1 to 3, 1.5 inch to 5/8, 25 to 27 is gonna be the needle gouge. And so 1 to 3, got it right here. So for that, we're gonna have 1 milliliter. Okay. So we check over here, Clarence. We checked his name. He checked his date of birth. We got into. We came into the room. We have well, actually, let's draw the medicine when we're in the when we are at the med room. So we're gonna give 1, right? So okay. We make sure we clean this before we do it, which I keep forgetting. But and then we'll, same thing as the previous ones, we make sure we label this, and yeah, and it's all safe. We go to the patient, we check in with him, we introduce ourselves, we do our 3 checks and everything, date of birth, name, medical record, and then we tell him, you know, we already, I guess I would mention again, but I would tell him all the patient teaching, the stuff that I mentioned earlier, and we would tell him, you know, it's gonna hurt, and here's your heparin. And so this would be in the stomach. It would be the abdomen. So we have our little, let's say our abdomen, and it's that could be like 3 inches, like to the left, to the other side, upper side or lower side. So we have all those areas that we should potentially rotate because the medicine is less likely to be absorbed if it's inserted in the same side all the time, or where it creates that, you know, crust. So for that, it would be a 90 angle. We clean 10 seconds, kill everything. 90-degree angle. And boop. So for this, we don't aspirate because it could cause coagulation. And then we ask him, you know, are you doing okay? Yeah, he said okay, because it can be painful sometimes. Beautiful. And remember not to do this, but I'm doing it. And I tell him, you know, I'll come back and check on you, just to see how you're doing later on. See if he has any bleeding, any bleeding at the site, or any blisters, or any hard lumps or hives, or anything like that. Or any, so yeah, our last medication, it's gonna be an intradermal injection. So for this we're gonna apply our intradermal. It's gonna be our 1 milliliter syringe, and it's going to be our 5/8 of length to half an inch, and our needle gauge is gonna be 25 to 27. And it's gonna be our TB shot, tuberculosis. So we do our teaching, same thing. We make sure we tell them you know, if it's swollen or anything like that, you know, to make sure he comes back and checks because it could be infected. We educate, and then that's gonna be our TB. It's labeled already. It's ready for us. And for TB, let's say we're gonna, I think it has, right? Demonstrate here. Yeah. So let's say it has 3. It has 0.5, 5 milli. Yeah, 0.1. Let's say 0.1. So for this one, it's gonna be at a different angle. This one's gonna be at a 10 to 15 degree angle, so it's gonna be barely on your skin. So we're gonna have, this is gonna be our forearm. We're gonna clean it. Should we clean? And then after that, we're gonna press down. And then all of these injections, by the way, we gotta make sure we like stretch the skin. And so that 10 to 15 angle, so it's gonna be barely there. And then aspirate, no bleeding, and so we let it go slowly. So it's like almost like at skin level, but just right there. And then so, yeah. Should I lock this? No, let's not lock it. Either way. So that's that with TB. So we would tell him if he comes back later, we would check on him. We have to check his reaction within a day or 2, I believe. And then if the area is swollen, that means it's infected. If it's not, if it's just, you know, a little bubble, that's fine. And last but not least, let's go over the C-track technique. In the C-track technique, it's basically just grabbing the skin and pulling it back. Let's use this. Yeah, it doesn't matter. Let's use this. Yeah, why not? So it's basically retracting the skin back where you're pulling it and you're inserting it, right? But you're cleaning and everything, you know, you're doing everything the same. But the purpose for, you know, you do it, you take it back, you do it. The purpose for doing this is that you basically want to move the layer of the top skin, that it moves so that after you give the medication, the level of fat that we have, subcutaneous, top layer, goes back to the middle, and it just, you know, it's at a different angle at each layer, you know. So yeah, that's with the C track technique, and that's gonna wrap up this video.